So welcome back guys, it's Cringe Perfect, Cringeista, and we're back with one of the last sections of the Doctor, essentially like series on SJT. So we'll be finishing it off, and it says one of the first things, it says your doctor should never harm public perception of doctors by being irresponsible outside the workplace. I've explained this in one of the earlier videos, but anything that can affect public perception of doctors can mean that they reduce the compliance rate in treatment plans. Oh, there's an ant coming or whatever that flying beast was. But now getting on to the second point. Now a doctor should always be open to the advice of senior consultants. We all know that we're never going to be perfect. Just because now we have the title doctor or DR in front of our name doesn't necessarily mean that we know it all. So this is vital, especially if advised by senior nurses. It doesn't have to be a senior consultant, and you should take the advice, especially if they are right in this case. If you're incorrect and it's clear that you're incorrect and you still persist, a very, very awful thing for you to be doing. Now the third tip is that you shouldn't be confrontational with any of the patients regardless of their attitude. What do I mean by this? Even if the patient is just about to punch you in the face, you have to firm it. You have to pretend like you're their best friend. By doing so, you're not escalating the scenario. It could be the case that he assaults you, assaults your other team members who try to intervene and stop this from happening. You don't know your scenario. He could hit you with the tray of scalpels. I don't know what is inside the GP room, what is inside the hospital. So the best thing to do would be to call for security, but to calm him down, to call for backup. It sounds like a Black Ops movie. Now the fourth point is to never undermine any colleague, as it could affect the public perception of healthcare. This entails not slandering any of your team members, not backbiting them, whether it's true, whether it's false. It's important that you ensure anything that you do say is positive of your team members, so that the patient who's there believes that he's protected by people who are informed and not delinquents. Now even that's probably not the best language to be using, but that's how it is, especially if a doctor calls another doctor, this one's a dumb doctor. You'd honestly, yes, they may not be dumb, quote unquote, because they know how to be a doctor, but that description can really cause a person to lose trust and lose confidence in the NHS. So now we're on to the fifth point. Doctors should never advise illegal procedures and take patient notes out. I should say out. Now as a doctor, we all know that no one can advise for a procedure that's illegal to take place, such as euthanasia, due to the fact of what it entails and how it potentially goes against one of the fundamental things that doctors are there for, which is to preserve life, and euthanasia is essentially taking life. Now we'll go into that in the interview course, so you don't even worry about that and go crazy about that. So they won't really ask you anything regarding it. And the second point about never taking out patients' notes at all times is for the basis of confidentiality. I'm just going to say confid. The reason for this is that if the patient knows that his allergies, if his address, if his job, his background is all leaked and someone's reading this, it could really affect them, especially if someone doesn't hope the best for them. Now they have their address, now they have all their other details, which essentially is a breach of privacy, and that's the last thing that a person will want, especially when dealing with a disease, and mindset is a big benefit to their recovery. That may sound like pseudoscience, but I'll explain that in the interview course. Now the sixth or fifth tip, I need to actually number these. If the doctor is threatened, he should report them in a timely fashion, not 5 years later, 6 years later. He should report them maybe straight after the consultation. If it needs to be within calling for porters and bodyguards to come in, security guards to come in and to help, especially if they're feeling as if they're about to be assaulted. So timely fashion, that's the sort of thing to do. If, for example, if you're being assaulted or threatened, then you do not report. It'd be something that's very inappropriate, on the basis that you are harming other patients and now you're thinking about how to protect yourself against all these other scenarios. So it's important that you're able to focus, especially while you're a doctor working as a doctor. Now the sixth point I've basically just explained, so I'm gonna cross that out. Doctors shouldn't suggest or hint at a complaint procedure unless the patient has asked for one. For example, it just sounds ridiculous, but it's something that some people probably have a tendency to do. For example, if the patient is complaining about how cold the room is, It seems quite obvious, but the doctor shouldn't say, well, yes, it is cold, do you want to complain about it? That's the sort of things that would be awful and something ridiculous. So try to avoid things that are not necessary. Sometimes even if they claim to be disappointed with your conduct, but you know for certain that your conduct is upright, it could be that they're having a bad day, so you wouldn't hint at a complaint procedure on the basis that they could be under the influence of anger and so on and so forth. On to the 8th point, it says that doctors must not send any colleagues home, especially if newly graduating from med school. For example, a junior doctor comes in, another junior doctor knows him and he says, I know you, well, you're a naughty one, now go home. On the basis that you could cause pressure to be placed on your other team members, which could lead to mistakes, the untimely delivery of medication, and so on and so forth. Again, linking back to the thing that supersedes everything else, which is patient safety. Now, I've mentioned this prior, but asking for advice by a more experienced medical professional is always an appropriate thing to do. If you do not know, it's the most appropriate, so it would be amazing and something that is very, very appropriate. If you do know, but you just want clarification, just like you performed the procedure a couple of times, but you still, I don't know, you might want to check up again, it'd be something that is appropriate, and it may not be very, very appropriate because you have trust in yourself and in your experiences that you haven't forgotten it, but you just want that supervision. Now, the 900th tip, doctors shouldn't badmouth other doctors. I'm not saying that to be arrogant or anything like that, just in case. Doctors should never badmouth other doctors. I've explained that prior. Doctors are advised to have a sick day if they believe that it will affect patient safety. Now, it's important that the doctors are in their best state of mind so that they do not cause any mistakes or be the reason for mistakes to take place. Hence, it's important if it affects public safety. Now, the 901 tip is it's imperative that the drunk or intoxicated doctor is removed instantaneously. So, for example, if you know that the doctor is falling over left and right and he's just about to treat the patient, for example, grab the scissors. Let's leave that joke out of there. But back to the point about the doctor being drunk or intoxicated, he has to be removed from the scene on the basis that he could harm patient safety. And yes, that seems quite obvious, but just remember that, especially, it doesn't matter about how old he is, what experience he has. In that moment, he is not one to be making decisions, and you contact everyone that you need, whether it be porters, bodyguards, and that is the best thing to do and is very, very important and appropriate. Now, the last tip is that leaving the shift when not being covered is unacceptable and is an awful thing to do. So, for example, if you are called and the colleague who is meant to cover you says, I will be there in 30 minutes, no matter if you have a football game, no matter if you have a birthday party to attend, you cannot leave because you are harming patient safety. And yes, I'm not saying that you have to work there for an extra 4 hours if they don't turn up, because it will get to a point that you need to go sleep in order to treat patients properly. That's why junior doctors, when they were given 50 hours to work or so, it's not because they're getting paid too little, it's because they're being worked too much. If they're taking 12-hour shifts and now they're being told to add on 3 2-hours, it's just a 15-hour shift, and it's ridiculous. Like, it's affecting patients. That's why there's a stat in September, October, November on the release of junior doctors. By them adjusting to that 50 hours a week schedule, it's causing people or a greater mortality rate, essentially. Just summarizing everything, it just shows that it's important that you do take a break, that you do get your night's sleep, but you ensure that 30 minutes is not something that you would leave your role for. If it gets to 2 hours, you have to leave. You contact your supervisor and you tell them, I'm leaving in the next 10 minutes, and that's acceptable. And with that, we've essentially concluded the doctor segment, and yeah, I'm gonna end this. And yeah, if you have very minimal time, I have an ebook that is present in the link description, and that's my killer tips. Essentially, I explained them in the video, but there are some tips in there that I haven't really explained. Basically, catch you guys on the other side. Why is it hard?